Tom here, almost certainly not the same Tom I was referring to, said he was forced out of a professional football team in the late 80s due to the manager constantly wanting a player's knee injected to keep the player on the field. Week after week, he fell out with the team doctor and manager as the team doctor was willing to do this, although he was against it. But he was being paid a lot of money. This is in the 80s. So the doctor was being paid a lot of money, but he was doing what the manager wanted rather than what his instincts told him was best.
Yeah, it was absolutely appalling what went on. And once again, I recount stories about how England footballers' careers were finished by multiple injections before games at half times. And I talked about the Derby County in England player Roy McFarland, who was actually injected with steroid during a match. He was brought onto the touchline into the dugout and injected.
So talk us through physiologically. I mean, instinct says that that's a bizarre thing to do with someone who needs steroids, to give them some steroids in the middle of a match and bring them back on again. Physiologically, what is happening in this instance?
Well, it's not doing the player any good, as most of your viewers know. A steroid injection, which is a perfectly reasonable option and something I would do, is very good for reducing inflammation, swelling in a joint if needed. But it takes time to work, and I'll tell my patients this is going to take 3, 4, 5 days to begin to work. So the only real benefit of that injection is going to be the local anaesthetic side, which kind of internally numbs the joint, and it really, hopefully it's something that's been banned. I have a real problem. I often get players turn up in my clinic on a Monday, Tuesday, with a request. Can they have an injection to get them fit for Saturday? At least we've gone back a little bit from the days of doing it immediately before. And I said, it's just not going to work. I mean, you need a planned program of when the player's going to have some downtime. I mean, I do feel a reticence that you do have to occasionally offering young athletes steroid injections. It should be absolutely the last resort as far as I'm concerned. There are other injectables I use. Viscosupplementation, which I describe to my patients as engine oil. I think that's a safer option, but they take a long time to work.
But we're still talking about, aren't we, injecting somebody. Something has caused that inflammation.
Yeah.
There are therefore tissues that need to heal. And, well, where do you stand on exercising through injury? I mean, clearly it works for some injuries or some individuals.
As far as exercising through injury, it depends. I mean, most athletes at the top end, and we've published on this, are usually performing with some injury. And we looked at footballers at different levels from the Premier League downwards. And when you get down to Division 1, Division 2, because they're much smaller squads, the number of injuries that people are playing with increases. So if you said you're not going to be able to play or train without this injury, you wouldn't have a squad, and you wouldn't be in the club long. But you've got to come to a view, and you've got to advise the player and the club as to whether they're likely to do themselves harm, through playing on, and try and give them a view on quantifying what that risk is.